Hello friends, welcome back to Complete Medical Coding. Today let's discuss few more CPT practice questions and I will show you how to use the CPT codebook as I got many queries to show how to use the codebooks, both CPT and ICD. Today I will show you how to use the CPT codebook. Okay, this is especially for the beginners. So friends, stay tuned, and if you are new to the channel, please subscribe to my channel. Let's move to the questions one by one. So first question, what is the CPT code for right modified radical mastectomy including axillary lymph nodes without any muscles? So let's begin with small questions so that it will be easy for you to understand how to navigate through the code books. Okay, that's why I have chosen a simple question in the beginning. So here we have to find out right modified radical mastectomy. So you have to find first the code for, or first you have to code the session for mastectomy. So you need to navigate to mastectomy first. Then in mastectomy, under mastectomy, you have to find what is the exact CPT code that we need to use in this question. Here it is mentioned mastectomy including axillary lymph nodes without any muscles. So first let's find out where is mastectomy in the CPT codebook. Okay, I'll show you that. See, when you open the CPT codebook, okay, on the first page you will see so many topics which I have already sticked it. Some stickers you will get it here. Okay, this is actually helpful and you can use it for the exam also. No problem. You can stick it like this. Like for example, see, for E&M you can put E&M sticker. Anesthesia, you can put anesthesia sticker. See, surgery, integumentary, musculoskeletal, respiratory, like that you can put. So it will be easy for you to navigate to the answer. See, cardio, digestive, like that you can put the sticker. I think it's visible for you. Like this, see. Radiology, you can put the sticker when it begins. Lab and medicine, like that you can put the stickers. You can take it out from here and see, few are still pending for me. So like that you can stick the picture, this picture, see, index page. You can take it, remove it and stick it to the index so that every time you don't have to go to that page. Okay. See, in this code book, we need to go to the index page first. Okay. So find out where is the index page. See, the page number 871. You have to go to this index page. Okay, I'm using my old CPT book because I didn't receive my new one, so I'm just showing you with old one, but the codes are updated whatever I am showing you. Okay, so this way I'm opening the index page. See, index page, I had marked it, labeled it, so it will be easy for you for navigation. Okay, so go to the index page. Then first you have to take mastectomy, right? This is index page is alphabetical order. So you can go to M, take mastectomy. Mastectomy, it's here. We can see mastectomy is here. See, under mastectomy, there are many options, many medical terms written. Gynecomastia, modified radical, partial radical, simple, complete, subcutaneous, like that. What we need is modified radical mastectomy. So you need to check whatever we need is mentioned here or not. Modified radical is mentioned, right? modified radical, which is 19307. The CPT code is 19307 written here. Okay. Sometimes if it is single, they will mention only single CPT code. Otherwise, they will mention a range of CPT codes. See, like this, a range, which is mentioned in radical. So here, since we need modified radical 19307, but don't blindly mark the answer as 19307. You have to go and cross check. You have to go to this code and cross check whether it is right or not. Okay, so go to this code 19307 under integumentary section. So go to 19307. See, it's here, 19307 mastectomy. See, it's here, 19307 mastectomy. What is the description of 19307? It's here, mastectomy. Modified radical, including axillary lymph nodes with or without pectoralis minor muscle, but excluding pectoralis major muscle. So with or without muscle, as mentioned in our question. See, modified, what is in the question? Write modified radical mastectomy, including axillary lymph nodes without any muscles. Everything is here, right? Modified radical, including axillary lymph nodes with or without muscle. In our question, it is without. So, this is correct. And you need to always check whatever is mentioned down in the bracket. Anything in the bracket. If it is needed, if it is connected with our question or not. This is nothing connected with our question. Intraoperative placement of clips for immediate or delayed insertion of implant. No, we don't need that. Okay. So here, since this is the correct code 19307. Okay, we got the answer as 19307. So, second question. Patient had a sphincterotomy with ERCP with stent placed in bile duct. How will you report this procedure? So, here the procedure done is sphincterotomy. Sphincterotomy with ERCP and stent placed in bile duct. Okay. So, let's look into the index page and you have to take the code, the word sphincterotomy. You have to search for sphincterotomy. Okay. Now, here in the question, patient had a sphincter rectomy. Sphincterotomy. Sphincterotomy with ERCP with stent placed in bile duct. So first you need to go to sphincterectomy. Go to index page. As I mentioned, go to the index page. Take sphincterotomy. I'm showing, but I think it's little difficult for you to see. With little difficulty, I'm taking this video. But since you people have requested to show how to use CPT codebook, that's why I'm doing like this. So take sphincterectomy, go to S. Sphincterotomy. See, it's here. Sphincterotomy. I think it's visible for you now. See, sphincterotomy. This is sphincter. In our question, it is written sphincterotomy with ERCP with stent placed in bile duct. Under sphincterotomy, you can see anal and bile duct. In our question, it is bile duct, right? So you have to go to this code, these codes. You have to check all these codes. 43274, 47420, 47425, all these things you need to check to get your correct answer. Okay. So let's take this code 43274. Go to registry system and take 43274. See, 43274 is here. Here. This is an add-on code, not add-on code. This is not the first code. See the description. It is starting, so it will be starting just before this code. Okay, so go here and check what is written here. Where is the starting beginning of this code? These codes, all these are not the initial code. Go to the initial code, which is here, 43260 ERCP. ERCP is the initial code. See here, ERCP 43260 here. ERCP, endoscopic retrograde cholangio pancreatography. Diagnostic 43260 is ERCP diagnostic, including collection of specimen by brushing or washing. No, that is wrong. Which code we took? 43274, right? Let's check if it is correct or not. ERCP with, you have to read like this, just before the semicolon. See, if it is semicolon, it means this ERCP is common for the codes which are showing below. ERCP. And then after semicolon, the description is the description belongs to this code 43260. So ERCP semicolon diagnostic, including collection of specimen by brushing or washing when performed. This description belongs to code 43260. Now if you see the second one, 43261, ERCP semicolon, then read the next one, ERCP with biopsy single or multiple. This is how you need to read for the description for CPT code 43261. Okay, ERCP with biopsy single or multiple, that is the description for CPT 43261. Now if you go to 43262, again ERCP with sphincterotomy or papillotomy. See the description which is starting with small letters. It means it belongs to some other initial code, some other initial procedure. Okay, it's like that, the connection. I'm just explaining this. Mainly for the freshers, mainly for the new students. Okay, how to read, how to navigate through the CPT codebook. So ERCP with sphincterotomy or papillotomy, that is 43262. Okay, so like that, there are so many codes under ERCP. What we need is, what we are looking for is 43274. So how you read 43274? Again, ERCP with placement of endoscopic stent into biliary or pancreatic duct, including pre and post dilation and guide wire passage when performed, including sphincterotomy when performed. Each stent. Yes, this is what we need, right? Sphincterotomy with placement of stent. So everything is there in this description, in this code 43274. ERCP with, what is in the question? ERCP with the stent placed in bile duct. So ERCP with placement of stent into biliary duct. See, biliary or pancreatic duct, which is there in this code. So our answer for this question is 43274. And down it is written bracket that you need to just read it out. Just look what it is mentioned. Okay, do not report 43274 in conjunction with all these codes for stent placement or replacement. For stent placement in both pancreatic duct and common bile duct during the same operative session. This is for same pancreatic and bile. Anyway, in the question, in our question, it is only bile duct, so no need to read all this. So this is bile duct. So the answer is 43274. Okay. Now third question. The patient is a 22-year-old female who was discovered to have breast cancer on her right side. She was treated with mastectomy followed by chemotherapy and radiation therapy. So this is what has happened before. This first two sentences, right? She now elects to proceed with reconstruction by tram flap. Code for the reconstruction. So now the patient is here for what procedure? Reconstruction by tram flap. And the question is also that one, right? Code for the reconstruction. That's what we need to code. All this mastectomy followed by chemotherapy, radiation therapy, everything was done before. See, this is how you will get the question. It will be little confusing for you to, so you need to understand what exactly we need to code. No need to code all the histories. Whenever it is needed only, we need to code the history. So here anyway, the question is to code for the reconstruction. You have to code only the reconstruction by tram flap. So which code word you will search in the index page? Tram flap, not mastectomy. If you go for mastectomy, you will end up in so many confusions. Here, since the question is reconstruction, have to go for reconstruction by tram flap. So go for the word, search for the word tram flap in index page. I'll show you that. Now for this question, I'm taking tram flap you have to take, okay? So go to index page. See, I already took it. Go to index page and check for tram flap, T-R-A-M, tram. Where is tram? See, it's here. Tram flap. Here. Tram flap, breast reconstruction. This is what we need, right? The question. Because right now the patient is proceeding with reconstruction by tram flap. So breast reconstruction, tram flap. You have to go to index page and take tram flap. Below that, breast reconstruction. The code range is mentioned there, 19367 to 19369. So let's look into those codes. 19367 to 19369. See, here it is 19367. Let's read it out. Breast reconstruction with the transverse rectus abdominis myocutaneous flap, TRAM. That is the full form of TRAM. Transverse rectus abdominis myocutaneous flap. That is TRAM flap. So breast reconstruction with TRAM flap. Single pedicle including closure of donor site. What is 368? Breast reconstruction with tram flap with microvascular anastomosis. This is not mentioned in our question. Microvascular anastomosis, it's not there. What is 369? Breast reconstruction with the tram flap, double pedicle. No, this is not double pedicle, means double side. This is only single side, right? On the right side, breast cancer on right side. So only one side. So you have to use this code. Breast reconstruction with the tram flap, single pedicle using closure of donor site. So this will be our answer. 19367. I hope it's visible to you. Okay, 19367. Now fourth question. Dr. John performed a cryosurgery to destroy 3 pre-malignant lesions for an established patient. Which codes would you report for this procedure? So here cryosurgery is the procedure, right? Cryosurgery to destroy 3 pre-malignant lesions. Established the patient and all, they are just making you confused, just an additional information. So you have to go and search for the keyword cryosurgery. Okay, let's go to the next page. Now in here you have to take cryosurgery in index page. See, from the index page, go to cryosurgery. Because here the doctor has performed cryosurgery to destroy 3 pre-malignant lesions. This is a simple question. Okay, so go to cryosurgery. What is the code? What is the range of codes? 17000 to 17286. and then 47371, 47381. All these are there. And below that, there are so many like uh, medical terms present, like in which part it is, like that it is mentioned. See, bladder, lesion, hemorrhoids, prostate, all those, nothing is mentioned in our question. So it's just mentioned 3 pre-malignant lesions. The site is not mentioned, so you can directly go for these codes. Okay, cryosurgery, whatever range is mentioned here. 17 let's look into this one first. 17000 to 17286. Go to 17000. See, 17000. I have taken 17000. Destruction. Example, laser surgery, electrosurgery, cryosurgery. Yes, we need cryosurgery. Okay. Chemosurgery, surgical correctment, pre-malignant lesions. First lesion. See, till pre-malignant lesions, example, actinic keratose. It is after that there is semicolon, which means this belongs to, this is the common one, and after semicolon first lesion, this belongs to the first code. So destruction, this is what exactly we need, the description, right? Description using chemo, sorry, what in our question? Cryosurgery. Description by cryosurgery, first lesion. But in our question, it is 3 lesions, 3 pre-malignant lesions, right? So for addition, add-on lesions, you have to use the next one. See, for the first lesion, use 17000, and then second through 14 lesions each. That is for the next add-on code 17003. And you have to understand what exactly is the description. You already got the code, the codes, right? 17000 and 17003. But this is 3 malignant lesion. 17000 is for the first lesion, and 17003 is for second through 14 lesions each. List separately in addition to code for first lesion. This means each code means from second to 14 lesion you have to use this code. This doesn't mean that from 2 to 14 lesion you have to use a single code. No, that is wrong. If in the question it is 3 lesion, you have to code 17000 and then 17003. For the remaining 2 lesion, you have to code 17003 times 2. Times 2. So this is for the next 2 lesions. 17003 times 2 you have to code, because this is second through 14 lesions each. For each additional code, you need to code this. That is what it is exactly mean. If this word each is not there, it means you have to use only one time. However, whatever the number of codes is, even though the code is 10 or up to 14, you need to code only once if this each word is not present. But here, since in the description the word each is present, you need to code it twice. Okay, that's how you need to code. So answer will be 17000 and 17003 times 2. Okay. Now I'll show you one more question, fifth question. An extracapsular cataract removal is performed on the right eye by manually using an iris expansion device to expand the pupil. A phacoemulsification unit was used to remove the nucleus, and irrigation and aspiration was used to remove the residual cortex, allowing the insertion of the intraocular lens. What code should be used for this procedure? So this question I had already, I think I had already done this question before. But here I will show you how to navigate to the code. Okay. So extracapsular cataract removal. So what is the procedure done here? Cataract removal. You have to always choose the keyword in order to find the, in order to search for that word. You have to first look, understand what exactly the question is, what procedure is being done here. So here cataract removal is the procedure done, right? And all others are additional keywords. So first you have to go to the index page and look for cataract. So go to cataract in index page. Below that you will definitely get a removal, the keyword removal. So go to cataract, then take the keyword removal. There you will get extracapsular, intracapsular, everything. So there you will end up in the code searching for the code, extracapsular cataract removal. Okay, I'll show you that. So here you have to go to index page and take cataract. You have to check for the keyword first in the question. What is the procedure done here in our question? Extracapsular cataract removal. So cataract removal is the procedure done here. So you have to go to the index page and take cataract. Okay, here it is, cataract, and then under cataract you need to go to removal. See, cataract, and then you can see here extraction or removal. So many are written here. Decision, excision, extraction or removal. Then intraoperative visual access identification, incision, all these are mentioned here. Whatever we need, you need to take. So under cataract, go to removal because our procedure is cataract removal. And what cataract removal it is? See, below extraction or removal, two are written, intracapsular and extracapsular. What we need is extracapsular, right? So go to extracapsular. What is the codes here? What are the codes? 66982 and 66984. So you need to check both these codes. Okay, 66982 and 66984. Let's go to those codes. See, here it is. 66982. and 66984. Both are here. I'll read out this for you. 66982 extra capsular cataract removal with insertion of intraocular lens processes. One stage procedure. Manual or mechanical technique. Example irrigation. See, whatever is mentioned in our question, everything is written here in this code, right? In this description. We need, as per the question, we need extracapsular cataract removal. Okay, it is performed on the right eye by using iris expansion device. That is also written here. It's coming down. I will tell you later. Then phacoemulsification unit was used to remove the nucleus, and irrigation and aspiration was used. See, manual or mechanical technique. Example irrigation. This is also mentioned in the question. Irrigation or phacoemulsification technique. Okay. Requiring devices or techniques not generally used in routine cataract surgery. Example, iris expansion device. See, iris expansion device as mentioned in the first sentence in the question. Okay. Or performed on patients in the embryogenic developmental stage. Whatever we need, if it is present, it means that is our correct CPT code. All others are like you may get question, some other type of question for the same description, for the same code, but the description will be here. Instead of irrigation, they might have asked you for something else, maybe only phacoemulsification, or maybe instead of iris expansion device, they might have. So you may get question like suture support for intraocular lens or primary posterior capsulosis. All these you might get. These are different ways of asking questions. Okay. So here, since in the question it is written extracapsular cataract removal, and then finally in the last line in the question it is mentioned insertion of intraocular lens. That is also here with insertion of intraocular lens. Since extracapsular cataract removal and insertion of intraocular lens belongs to the same code, it's a combination code, you have to use this one. If intraocular lens insertion is not present in this description, then you have to code for what do you call it? Intraocular insertion of intraocular, you need to code separately. But since here there is a combination code, you have to use this code. Okay, so 66982 is our answer. 984 is separate. If you want, I will show you. 66984 is extracapsular cataract removal with insertion of intraocular lens processes, manual or mechanical technique. Example irrigation. Till phacoemulsification only it is mentioned here. This iris expansion technique procedure is not mentioned in 66984. But in our question it is written, it is performed on the right eye by manually using iris expansion device. So since that particular word is mentioned, you have to use this code. If nothing is mentioned in the question, like manual removal or nothing is mentioned, then you need to go for 66984. Okay. I think you understood. If you have any queries, you can ask me. So here in the question, the answer is 66982. So friends, as per your request, I had done one simple video. I know these are simple questions to show you how to navigate to the CPT code book. I'll come back again with more and more questions, practice questions for this navigation, CPT code book navigation. Okay, but in between that, I will come back with more questions also. Those who are preparing for the examination, that is also important, because this is taking much time for me for taking this video. That's why I got delayed for these few days. Anyway, I'll definitely come back again with the navigation of CPT code books. Okay, with more questions, frequently asked questions, and little more descriptive questions. Anyway, if you find this video useful, please support me. Okay, please like and share. If you have any doubts or clarifications, mark it in the comments. I'll come back to you. So stay tuned for more videos. If you are new to the channel, please subscribe to my channel. Okay. Thank you so much, friends. Bye. Take care. See you soon.